10 warning signs of prostate cancer. Prostate cancer is one of the most common types of cancer that affects men, especially as they grow older. In 2022, about 270,000 men in the United States were estimated to be diagnosed with this condition. The disease starts in the prostate gland, which is about the size of a walnut and sits right below the bladder. The prostate's main job is to help make semen, the fluid that carries sperm. That's why any problems with it may affect some important functions, like urinating and sexual activity. To remain safe, being aware of the changes in your body is crucial. Sometimes the first signs might seem like regular aging or minor issues that you think will go away on their own. Today, we'll talk about 10 warning symptoms of prostate cancer that you should be aware of. But there are ways to protect prostate health. To learn more, stay tuned until the end of the video. Now, let's start. 1. Difficulty with urination. In prostate cancer, difficulty in starting urination often occurs due to the tumor pressing against the urethra, the tube that carries urine from the bladder out of the body. This pressure may partially block the flow of urine, making it harder to start urinating. Additionally, prostate cancer may cause inflammation and enlargement of the prostate gland, further obstructing the urinary tract. This may lead to symptoms such as weak urine flow, dribbling, and a feeling of incomplete emptying of the bladder. Experiencing a burning sensation during urination is a common concern for people with prostate cancer. In addition to physical factors, urinary symptoms like burning during urination may also be influenced by urinary tract infections (UTIs), which are more common in individuals with prostate cancer due to factors such as urinary retention and catheter use. UTIs may cause inflammation and irritation of the bladder and urethra, leading to symptoms such as burning, pain, and urgency during urination. 2. Frequent urination, especially at night. Frequent urination is a common issue for people with prostate cancer due to various factors. One primary cause is the enlargement of the prostate gland, a condition known as benign prostatic hyperplasia, which often occurs concurrently with prostate cancer. As the prostate enlarges, it may squeeze the urethra, the tube through which urine passes, leading to irritation and inflammation of the bladder. This irritation triggers the bladder to contract more frequently, causing the individual to feel the urge to urinate more often than usual. Additionally, prostate cancer itself may directly impact bladder function. Tumors in the prostate gland may disrupt the normal signaling between the bladder and the brain, leading to an overactive bladder. This means that the bladder may contract involuntarily even when it's not full, causing frequent and sometimes urgent urges to urinate. Do you find this information helpful? Don't forget to hit the subscribe button and ring the bell icon for more health secrets and tips. 3. Blood in urine or semen. Finding blood in urine or semen is a distressing symptom that individuals with prostate cancer may experience due to various reasons. One primary cause is the presence of tumors within the prostate gland, which may lead to damage to blood vessels and bleeding. These tumors may erode into nearby blood vessels, causing bleeding that manifests as blood in the urine hematuria or semen hematospermia. Additionally, prostate cancer may spread to other nearby structures, such as the bladder or urethra, further increasing the likelihood of bleeding. According to studies, patients with prostate cancer have a significantly higher risk of urinary tract infections than those without prostate cancer. In some cases, blood in urine or semen may be a symptom of a urinary tract infection or UTI, which is more common in individuals with prostate cancer due to factors such as urinary retention and catheter use. UTIs may cause inflammation and irritation of the bladder and urethra, leading to bleeding. Moreover, individuals with prostate cancer may experience blood in urine or semen as a result of trauma or injury to the pelvic area, such as during sexual activity or medical procedures. This trauma may cause damage to blood vessels and tissues, leading to bleeding that presents as blood in the urine or semen. 4. Painful ejaculation. Experiencing painful ejaculation is a common concern for individuals with prostate cancer, often arising from several underlying factors. One primary cause is the presence of tumors within the prostate gland itself. These tumors may lead to inflammation and irritation of the surrounding tissues and structures, including the seminal vesicles, which are responsible for producing semen. As a result, discomfort or pain may accompany ejaculation. Furthermore, individuals with prostate cancer may experience painful ejaculation as a result of other non-cancerous conditions, such as prostatitis, inflammation of the prostate, or benign prostatic hyperplasia. These conditions may cause swelling, inflammation, and sensitivity of the prostate gland and surrounding tissues, leading to discomfort or pain during ejaculation. Apart from that, the emotional burden of coping with a cancer diagnosis may create a cycle of heightened tension and anxiety, particularly in the pelvic region. This tension may lead to increased muscle tightness, including in the pelvic floor muscles responsible for ejaculation. As a result, the contractions involved in ejaculation may become more forceful or irregular, leading to painful sensations. 5. Persistent pain or stiffness in the lower back, hips, or pelvis. Experiencing pain or stiffness in the lower back is a concern for individuals with prostate cancer, often linked to several underlying factors. One primary cause is the spread of cancer cells from the prostate gland to nearby bones, including the vertebrae of the spine. This spread, known as bone metastasis, may lead to the weakening of the bones and the compression of spinal nerves, resulting in pain and stiffness in the lower back. Furthermore, individuals with prostate cancer may experience lower back pain or stiffness as a result of other non-cancerous conditions, such as degenerative disc disease or spinal stenosis. These conditions may cause compression of the spinal nerves or irritation of the surrounding tissues, leading to pain and stiffness in the lower back. Moreover, individuals with prostate cancer may also experience muscle tension or stiffness in the lower back as a result of stress, anxiety, or physical inactivity. The emotional and psychological impact of a prostate cancer diagnosis may contribute to muscle tension and discomfort, particularly in the lower back area. 6. Erectile dysfunction. When prostate cancer alters hormone levels, especially testosterone, it interferes with the delicate balance essential for maintaining sexual function. Testosterone is pivotal in regulating libido, stimulating the production of nitric oxide, and enhancing blood flow to the penis, all crucial components of achieving and sustaining erections. Therefore, any disruption in testosterone levels, whether stemming from the cancer itself or as a consequence of hormone therapy, may profoundly impact erectile function. Moreover, the insidious nature of prostate cancer extends beyond hormonal fluctuations to affect the very infrastructure supporting erections. As the cancer progresses, it may infiltrate nearby blood vessels, impeding the normal flow of blood to the penis. This compromised blood circulation directly compromises the ability to achieve and maintain erections, as sufficient blood flow is essential for maintaining the erectile tissues and creating rigidity. Along with that, the psychological impact of a prostate cancer diagnosis may also contribute to erectile dysfunction. Anxiety, depression, and stress related to the diagnosis, treatment, and prognosis of prostate cancer may interfere with sexual function and arousal. Additionally, concerns about body image, changes in sexual relationships, and fears of recurrence may further exacerbate erectile dysfunction. However, prostate cancer itself is not the only cause of erectile dysfunction. It may also happen due to psychiatric disorders caused by prostate cancer or its treatments. 7. Loss of bladder control. Losing bladder control may be a symptom of prostate cancer due to its proximity to the prostate gland. The prostate gland sits just below the bladder and surrounds the urethra, the tube that carries urine from the bladder out of the body. As prostate cancer progresses, it may grow and press against the urethra, causing urinary symptoms such as difficulty urinating, weak urine flow, frequent urination, and incontinence, loss of bladder control. Additionally, prostate cancer treatments such as surgery, radiation therapy, or hormone therapy may also contribute to urinary incontinence by affecting the muscles and nerves involved in bladder control. For example, surgery to remove the prostate gland, radical prostatectomy, may damage the muscles and nerves responsible for controlling urination, leading to temporary or permanent urinary incontinence. Psychological factors such as anxiety, stress, or depression related to the prostate cancer diagnosis may also exacerbate urinary incontinence. Stress may trigger the muscles of the pelvic floor to contract involuntarily, leading to the leakage of urine. 8. Swelling in legs or pelvic area. Experiencing swelling in the legs or pelvic area is a concern for individuals with prostate cancer, often arising from various underlying factors. One primary cause is the spread of cancer cells from the prostate gland to nearby lymph nodes or blood vessels. This spread, known as metastasis, may lead to obstruction of lymphatic vessels or compression of blood vessels, resulting in fluid buildup and swelling in the legs or pelvic area. Moreover, individuals with prostate cancer may experience swelling in the legs or pelvic area as a result of other non-cancerous conditions, such as deep vein thrombosis (DVT) or pelvic floor dysfunction. Deep vein thrombosis occurs when blood clots form in the deep veins of the legs, leading to swelling and discomfort. Pelvic floor dysfunction, which may result from prostate cancer treatments or other factors, may cause muscle weakness or dysfunction in the pelvic floor muscles, leading to fluid retention and swelling. Furthermore, hormonal changes associated with prostate cancer and its treatments may also contribute to swelling in the legs or pelvic area. Hormone therapy, which aims to lower testosterone levels, may lead to changes in fluid balance and increase the risk of fluid retention and swelling. In a study involving 11,200 men diagnosed with prostate cancer, researchers found that 229 of them experienced venous thromboembolism, a blood clot, after diagnosis. 9. Unexplained weight loss or appetite loss. Experiencing weight loss or appetite loss is a concern for individuals with prostate cancer, often stemming from various underlying factors. One primary cause is the metabolic changes associated with cancer itself. Prostate cancer may disrupt the body's normal metabolism, leading to increased energy expenditure and a higher demand for nutrients. This increased metabolic activity may result in weight loss and decreased appetite as the body struggles to meet its nutritional needs. Moreover, individuals with prostate cancer may experience weight loss or appetite loss as a result of psychological factors such as anxiety, depression, or stress related to the cancer diagnosis and treatment. These emotions may affect appetite and food intake, leading to unintentional weight loss. According to a study involving about 220 prostate cancer patients, loss of weight, impotence, frequency, and abnormal rectal examinations remained associated with cancer. 10. Fatigue. Experiencing fatigue is a common concern for individuals with prostate cancer. Prostate cancer may trigger a cascade of physiological changes in the body, including the production of inflammatory cytokines and the activation of the immune system, leading to fatigue. Additionally, the cancer cells themselves require energy and nutrients to grow and proliferate, which may further contribute to feelings of fatigue. Furthermore, individuals with prostate cancer may experience fatigue as a result of other cancer-related symptoms, such as pain. The experience of pain, often chronic and inadequately managed, imposes a significant toll on energy levels, further intensifying feelings of exhaustion. Moreover, anemia, either induced by cancer treatments or stemming directly from the disease, poses another hurdle. With reduced levels of red blood cells, oxygen transport to vital tissues and organs is compromised, culminating in a pervasive sense of weariness. This diminished oxygenation amplifies the fatigue experienced by individuals, affecting their ability to engage in daily activities and diminishing their quality of life. About 30% of prostate cancer patients whose cancer has spread to their bones also have anemia during the time of the first diagnosis. Let's learn more about prostate cancer. The prostate gland plays a crucial role in the male reproductive system by producing seminal fluid, a component of semen that nourishes and transports sperm during ejaculation. prostate cancer occurs when cells in the prostate gland begin to grow uncontrollably, forming a malignant tumor. These cancerous cells have the potential to invade nearby tissues and organs, as well as spread or metastasize to other parts of the body, such as the lymph nodes, bones, or other organs. Risk factors for developing prostate cancer include age, with the risk increasing significantly after the age of 50, and family history, particularly having a close relative such as a father or brother who has had prostate cancer. Ethnicity also plays a role, as prostate cancer is more common in African American men and less common in Asian and Hispanic men. While some men with prostate cancer may not experience any symptoms in the early stages of the disease, others may notice symptoms which are explained earlier. However, these symptoms may also be caused by other non-cancerous conditions, so it's essential for men to undergo regular screenings, such as a digital rectal exam and a prostate-specific antigen blood test to detect prostate cancer early when it is most treatable. Treatment options for prostate cancer depend on various factors, including the stage and aggressiveness of the cancer, as well as the individual's overall health and preferences. Treatment may include active surveillance monitoring the cancer without immediate treatment, surgery to remove the prostate gland, radical prostatectomy, radiation therapy, hormone therapy to suppress testosterone levels, chemotherapy, immunotherapy, or targeted therapy. Follow these tips to keep your prostate bladder healthy with these daily habits. We understand that keeping our inner health safe and sound is our first priority. You may even protect your prostate and bladder by practicing some daily habits. 1. Stay hydrated. Drinking an adequate amount of water is crucial for maintaining bladder health. Water helps to dilute urine and flush out toxins, reducing the risk of urinary tract infections (UTIs) and promoting regular bladder function. Aim to drink at least 8 glasses of water per day, or more if you're physically active or live in a hot climate. 2. Eat a balanced diet. A diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats provides essential nutrients and antioxidants that support prostate and bladder health. Some foods, such as tomatoes, broccoli, and berries, are particularly beneficial due to their high levels of vitamins, minerals, and antioxidants. 3. Limit caffeine and alcohol. Caffeine and alcohol may irritate the bladder and increase urinary urgency and frequency. Limit your intake of coffee, tea, soda, and alcoholic beverages, especially before bedtime, to help minimize bladder irritation and promote better bladder control. 4. Maintain a healthy weight. Excess weight may put pressure on the bladder and increase the risk of urinary problems, such as urinary incontinence and an overactive bladder. Aim to maintain a healthy weight through a balanced diet and regular exercise, which may also help reduce inflammation and support overall urinary tract health. 5. Practice pelvic floor exercises. Pelvic floor exercises, also known as Kegel exercises, help strengthen the muscles that control urination and support bladder health. These exercises may be particularly beneficial for individuals experiencing urinary incontinence or pelvic floor weakness. 6. Don't smoke. Smoking is a risk factor for prostate cancer and other urinary tract conditions. Chemicals in tobacco smoke may irritate the bladder and increase the risk of developing bladder cancer. If you smoke, consider quitting to protect your prostate and bladder health. 7. Stay active. Regular physical activity promotes circulation, reduces inflammation, and supports overall urinary tract health. Aim for at least 30 minutes of moderate exercise most days of the week, such as walking, swimming, or cycling, to help maintain bladder health and reduce the risk of urinary problems. 8. Practice good hygiene. Maintaining good hygiene practices, especially around the genital area, helps reduce the risk of urinary tract infections and other bladder-related issues. Be sure to wash the genital area regularly, especially before and after sexual activity, to help prevent infections and maintain bladder health. If you experience any of the symptoms that may suggest prostate cancer, it's important to consult with a healthcare provider immediately. They may conduct appropriate tests, such as a prostate-specific antigen test, to help diagnose the presence of prostate cancer. Early detection remains a critical component in the successful treatment of prostate cancer, and recognizing these signs may be the first step toward a timely diagnosis. Now that we have discussed the many signs of prostate cancer, do you know that diet plays a big role in protecting our health, from kidneys to pancreas? Interested in learning more? Watch Save Your Kidneys from Damage by Eating These 13 Foods. Or watch 9 Foods to Save Your Pancreas from Damage. Watch one, or even better, watch both. What are the other signs you know that may indicate prostate cancer? Let us know in the comments below.